concept is silly, ridiculous, a waste of time. They didn't want. That's why they were so successful. That's why they got away.
Made a living in very dangerous.
This is really an integrated blue society.
Dianne Andrews in black and white.
Welcome to Dianne Andrews in black and white, and I'm your host, Dianne Andrews. I think you probably can figure out in our 3 million homes that we go into what this show is going to be about. As you know, I've done about 20 shows on COVID, from telejustice with Judge Don Johnson to virologists, infectious disease doctors, internists, psychologists, psychiatrists. We've done financial experts, CPAs, accountants. We've done every aspect of how COVID changed our world. And I think COVID is here to stay. As you can see, there is a struggle here to try to be safe. There was the shield, and under the shield I had on, first was the 3-ply layer that you'll see most doctors, a lot of nurses wear this in the hospital. That's 75% effective. We're going to talk about that with Dr. Gertie. And then I had on, I didn't have on the N95, and what that means is it's 95% effective. You'll see this in surgery centers and people who are doing surgery, and that's 95% effective. That's really the best mask out there now for any virus, especially COVID-19. Then I had on the Who Dat mask and then the United States mask. So we can make a decision, do we need 5 masks? After Fauci said that, I saw people with 3, 4, and 5 masks on out in the community. I'm sure some of them got masked, the disease you may get, for overdoing it with masks. But thank goodness, after saying we needed 2, 3, 4 maybe a month ago, now we don't have to wear a mask if you're vaccinated. Because even after vaccination, I've been vaccinated over 2.5 months. And I still had to wear a mask. And I'm thinking, it's really mostly the efficacy is so high. Why do I have to wear a mask if I'm around people who are also vaccinated? So the CDC, Dr. Walensky did change that, and Dr. Fauci has gone along with that now. So thank goodness if you're vaccinated and the people you're with, indoors or outdoors, and outdoors has always been less prevalent, 20 times less prevalent than catching the disease indoors because of vitamin D and the ventilation outside. But we still do have to wear masks, I think, on planes, on mass transportation, and there are other, and depending on a restaurant you may go in, they'll tell you to wear a mask, whether you're vaccinated or not. You know, we are going on the honor system, so I guess some people may not believe what everybody says. Somebody asked me the other day, how many people you think are going to tell the truth? I would think about 70%, because I would tell everybody who had it is going to tell the truth. And a lot of people are so belligerent about not having it, they'll tell you, no, I ain't having it, and I'm not going to have it. I'm not going to take it. So, but we'll see. I think Dr. Gertie started laughing. We'll see when we come back with Dr. Gertie thinks maybe 20% who's going to tell the truth. So come on back to Dianne Andrews in black and white and learn more about COVID-19 a year later. I started the COVID journey in March because I read about it in January when the administration stopped the borders from China, where 14,000 people were traveling a day. Between America and China, it was 5 million people were traveling a year between China and America, and the borders were stopped at the end of January after one of our first index patients coming in from China. So come on back to Dianne Andrews in black and white. Let's talk to an expert on COVID-19. Welcome back to Dianne Andrews in black and white, and I'm maskless now. So as we all are who have been vaccinated in the country now, we can go maskless, except depending on your local township or the businesses you may be in. But the CDC, as we said, had talked about it. Now, Doc, this is my friend, Dr. Gertie, infectious disease specialist here in Baton Rouge, Louisiana. She's got so many accolades and in so many task groups and concerning COVID. So we have a real expert here who's from Nigeria. And as I said in the last year she was on one of the COVID shows, I did the DNA in my mother's ancestry. She had those beautiful cheekbones like Dr. Gertie. I look more like my daddy. And his people were from Norway. So yeah, I had 2 ends over there, one from Norway and one from Nigeria. They weren't, but you know, their ancestry was. Mm-hmm. So Dr. Gertie grew up in Lagos, Nigeria. And she went to school there, and she did her and medical school there too also. But she did her residency in New York.
Yes.
And she is now in Baton Rouge and been here for how many years now, Dr. Gertie?
I left New York about 13 years ago.
13 years.
So, yeah, after fellowship in infectious disease.
Were you the first black infectious disease specialist female here?
At the time I came, there was none other. And
Yeah.
I don't think there is another one anyways.
In Baton Rouge.
Yeah.
But there's some in New Orleans maybe?
I think so.
Yeah, I thought.
Yeah.
Well, let's talk a little bit, but tell them your story about some of the COVID task force you work around the world. Yeah.
I am, so full name Dr. Gertrude Chimeka-Anyanwoke. I am a fellow of the Infectious Disease Society of America, a member of the Association of Nigerian Physicians in the America, AMPA for short, and I am the current chair of AMPA National Infectious Disease Committee, as well as the current chair of AMPA COVID-19 Task Force. I've also been chair of a COVID-19 Task Force back in Nigeria during this period.
Now, do you travel to Nigeria, Dr. Gertie?
Usually,
or is it all
yes,
Zoom
but no, well, before,
Yeah.
but since COVID, everything
Yeah.
has been through Zoom.
Right.
Yeah.
So, so you do work in Nigeria also, or is just for certain charitable
Charity.
kind of through the
I
medical?
do go for medical missions in Nigeria and other places, mainly for charity.
That's nice. Well, let's talk a little bit about the little episode I did up there on the masks. Of course, this N95 is still the #1 for safety against viruses, correct? And 5% you're liable, but it protects you 95% from the COVID vaccine virus. That's why these were in such short supply, and people were saying don't use these, don't buy them all up because they needed it for the hospitals in the beginning.
Yes.
Now the shield, if I put the shield on that I had on top of this, would that give me any more? Would that shrink that to 2% vulnerability or anything of that 5%, that shield on top?
I really doubt. So the shield is, it'll help shield, like say there's a huge particle of saliva or molecule that's gonna come to your face, and it can shield that, but it's open. So if it's like tiny
But if
molecules,
I have this on under it is what I'm saying.
well, yeah, if you have this under this is still protective, at least 95%.
And that may help some with something. Or not.
The shield will help with like large particles.
Yeah, so it's
from
useless
getting-
if you have this on, pretty much. That's what you're saying. Okay, so people selling that, you can take it off the market. Cause I'm making a joke. Hey, I was just trying to wear my shield only because you feel so free with the shield compared to this. And the next is, me being in healthcare too before, I know this is like 75 to 78% effective, isn't it?
Correct.
And that's what all the nurses usually wear. That's what we had carried. And we carried the N95 too for serious bacterial infections or viral infections when we went into the patient's home.
Yes.
So this is the next most
Best,
potent one.
yeah.
Now, my little hoodat, do you think this may be 25%?
Well,
Let me let you look at the materials of these, the hoodat and the flag.
Yeah, so a lot of times it depends on what material. So this actually has another material in there.
Yeah.
And so this might be approaching the same effectiveness as the
As the 3-ply?
the surgical mask.
the surgical.
Yeah. So this actually is good.
And we you mentioned that in the last show, to put some stockings.
Yes.
To make them, I could cut out some hosiery and put them in this because this one is nice, which I bought on the streets here in Baton Rouge, but it has a slot that you can put what filter you want in
Correct.
there. Some people have talked about coffee. I think I read something about even coffee filters could help.
I mean, it will help better than just it being
nothing.
plain cloth.
Right. Like when I see some politicians with a silk dress on and this is the same material they're wearing in their mask that they had cut.
But we don't know what's layering
under
inside,
there. If it's not layered though, tell me how effective it is, Dr.
If it's not layered, it might not be, maybe not even up to 30%. So.
Yeah, so it's kind of useless.
But most of them are layered.
But you know what? When I was researching for my book, Cover Up ID 2019, the CDC, I finished this in October, the CDC had the stats on there. 88.5% of everyone who got COVID, whether they died or didn't, they said they wore a mask. Now, it could be improper wearing, and that brings me back to this. Some people were putting these braces over the mask to keep air from coming down if you had the mask on under there, so your nose and mouth were always kind of protect it from the air coming in from any of the masks? Had you ever, I don't think you'd even seen these before. I got every little gadget you could have. I never wore it. but because I was doing a show, I had bought it. They call them braces that go on top of even the N95.
To keep it in place.
To keep it in place.
Because a lot of,
don't you see people
Yeah,
all
a lot
day?
of times it's falling off.
It
So
is.
if you have something that keeps it in place, it actually helps.
Right. And then some people, you know, this after you wear, some people wear them more than once. And when you wear them, this gets a little loose. Some people, you know, you just tie them a little bit and make a little loop in there so it becomes tighter on the face.
And we all have different ear shapes.
That's right. I couldn't hardly get the 4 on my little ears. So, Dr. Gertie, since we talked about variants in our last show back in the summer of last year, I think the UK variant was out then. Now, America has, I think it's 165 million cases in the world, 33 million people who have died. America's number one for deaths at 587,000 this morning, and over 3 million people who contracted. But next is Brazil, who had that bad variant there in Brazil. Brazil is 200 million people, and they lost 450 million people so far to the virus. And then I was surprised India was number 3. You know, that's 1.5 billion people in India, and they've lost about 280 million people from the virus.
I think that's undercounting a lot of it, because from what I understand, a lot of people that were sick and got to the hospital couldn't get a bed, couldn't be attended
so they couldn't even count them.
And so the people that were counted are people that they knew for sure were in the hospital. A lot of people died and never got
Because
counted.
India has that virulent, what is it, the 1617? I always think of 1619 project, and it's the 1617. What is the B in front of, like the B117, the B135 for
It's
South
really
Africa?
the position. So when you think about the COVID virus, there's a core to that spike, right? So because a lot of the vaccines are made targeting that core,
Yeah,
right?
it's a spike
The
protein on the end of it, yeah.
So, so it's the position of the mutation on the core.
Okay,
of the
because
virus.
the Brazil one variant or mutation is called a P1.
P1.
So it's
yeah.
in a different, I
It's
wanted
a
to ask you that.
position.
Yes, yes.
It's the position. So there's like, you can say there's a B and there's a P, there's a L, there, you know, there's different positions on that core. That's where you get that mutation. Yeah.
And a lot of them are Bs, of the ones, the South Africa, the Brazilian, I mean,
Correct.
not the Brazilian, but the India and the UK are all
The UK variant,
Bs,
they are all Bs, yeah.
And the only P I saw was the Brazilian was a P, so it's in a different position.
Yes, and there's the E484.
Where's that one from, Doctor?
That was in South Africa.
Another one in South Africa. So
And it was really virulent, but it didn't seem to take up and, you know, just
Travel, like,
overshadow the way that the UK variant have done.
Yeah. There were 800 million doses, enough for 500 million people, because J&J, though, is the only one that's a 1 dose, and everybody else is a 2 dose, including...
As at this time for all the approved vaccines.
Yeah,
J&J's,
the Novavax is going to be a 2 dose.
Novavax,
Yeah, they're
yeah.
supposed to be asking this month for requesting an emergency use authorization, which everybody has now, except AZ and AstraZeneca and Novavax, which all these are American. We were talking, China also has a vaccine, and so does Russia. Sputnik 5, named after that launch they did, I think, years ago, the Sputnik. This one's named Sputnik 5. And then Spiropharm, I think, is China. And Russia is saying they want to be the provider of the vaccines for the world. In fact, Mexico, I was reading, has purchased some from Russia. And what were you were saying about that earlier? They put it out before they may have put it out before they properly tested.
Oh, no, they did put it out before the proper
Yeah.
testing. I mean, that's not the usual route. So it was like, you know, you put it out and then
and then people die, and you say, "Oh, well, I didn't test long enough."
No, we don't have
that.
that.
I mean, potentially they could if you do
yeah.
that like
but
that.
the data they have right now, after they've done their studies and trials, are pretty good.
On the Russian one?
Yeah.
What
on
about the
Russian one.
Chinese one?
The Chinese one is also fairly decent. I think that's the one they may have in Brazil. I think it's fairly decent. The thing is that they all have a range of activity, and all of them seem to be able to at least minimize COVID. Even if you get it, the symptoms will be much less.
Now, from what I read, and of course you read things different, but this is from science magazines and talking to other doctors and interviews, for death, all of our vaccines that are out right now today, the 3 that we have out, is 100% effective. From you, Dianne. Is that true?
After 28 days.
Mm-hmm.
Yeah, all of them seem to be it's very difficult to die from COVID if you've already gotten vaccinated. Now, there are people that have comorbidities, have
Of
other
course.
medical problems
Right,
already
right.
that could do them in.
Right.
And so the fact that you got COVID vaccine doesn't stop the other medical problems that can actually take the life of that person.
Now, I was reading obesity is one of the major comorbidities for death.
Correct.
In fact, number 1, even more so than a cancer, immunology disorder, or diabetes or hypertension. Is that because of all the stress that obesity puts on your internal organs to try to maintain your life, period, with that disease, Dr. Gertie?
The assumption is that, but I don't think that we have good enough data to
know
say
why.
But it's just an observation that people that are obese seem to be really hit hard.
And America is one of the most obese countries in the world, and we're number 1 in deaths. We are. And during the pandemic, I think it got worse here in America, that the amount of, and probably all over the world, but I know in America, a lot of people trying to exercise now. In fact, I do a fitness show after this one, and we're trying to get people into fitness because of what was going on. The physical trainer, Iron is the name of it, will be coming in and helping people to try to discard some of these extra calories and extra fat cells that we've all managed to obtain. I had noticed maybe around May, June, I was starting to gain a little weight, and I started exercising more and stopped eating as much. So I did, for me, those I'm so short, 6 pounds is the size, so it may have been 4 pounds, right? My dress is fitting, but if you continue to let it go, that's how you get it out of whack.
Out of work, yeah, that's correct.
So we've got the world right now has a pretty substantial amount of vaccines out there, it seems, with China, Russia, and the ones coming from America. About 5 will be coming from here, it seems, 5 to 6.
It's not enough,
Still not
during
enough. What about the cost? We're giving it to Americans free, but let's say these underprivileged countries, how are they going to be able, they can't afford to pay Pfizer, they can't afford to pay China. I wonder what's happening as far as that with the world associations. I wonder if your task force deals with that.
Somewhere like Africa, they have the African Union that's negotiating with the vaccine manufacturers. But there's COVAX. COVAX gives about maybe 20% at least, that's what they said, they projected, especially for countries like Nigeria. And then the rest should be from the government of that country. But in Africa, they came together and decided to buy together, so African Union negotiates with the manufacturers
to get a good deal on the vaccines.
Yeah.
And is there an aim to vaccinate all of their people, everybody in
that
Nigeria?
Was the initial goal, so I don't know, I don't think that has changed, but the way it is going, right now, I think Nigeria got 3.92 million doses. That was the beginning of, I want to say March.
3.92 million?
Correct, million doses.
But how many people in Nigeria?
Exactly.
Yeah, that's a drop in the bucket, isn't it?
Yeah, that's the AstraZeneca vaccine, which you need 2 doses.
Right.
And the country is about 200 million people.
Right.
So you're going to need 400 million doses.
Why do you think AstraZeneca, which all of them have different small, minute problems, from blood clots to anaphylactic reactions, but it's very, very minute. The risk is definitely worth the risk is worth the reward of taking any vaccine that's out and been through the emergency use authorization over here. Why do you think AstraZeneca, I wonder, has been, it's in many countries around the world, I was reading last night, and it's doing very well at the rest of the countries. I wonder why it has not been given, and not that you would know, just a comment I had that the EUA has not been given to, EUA is not given to the AZ in here. Because it is from here.
I think it's in process.
AstraZeneca's
I think
from
it's in process right now.
Yeah.
And I'm not sure the exact reason. Sometimes they'll ask you for something else, and then
more
you
trials,
have to
phase 3s or something,
whatever. So I'm not sure, but I think it's in the works.
Yeah, because it's been out in the rest of the world since December. It was out, pretty much when Pfizer and
every
Moderna
country has to do
their own rules. That's right.
Studies and make
Yes.
sure that it's good for their own people.
Right.
Yeah.
But I think America did such a great job with, 5 vaccines on the horizon, 800 million doses. I remember when Dr. Brown, she came in, she had her Pfizer. That was probably January or February we did that show. And Dr. Brown, who had it, and she was just elated. We did her 4 hours after she had her vaccine. And so, I mean, all she could do is thank the administration, the previous administration, everybody, Operation Warp Speed, everyone who worked on making this come to fruition, who did a great job with this.
After watching how hard it was, and
Yes.
the fact that we actually lost patients, and
Right.
some of my patients actually had stroke as a result of COVID.
From the stress of COVID on their bodies? Yeah.
COVID can cause increased risk for blood clots
Right,
itself. COVID
right.
itself, and that's what people don't seem
What
to
about
realize.
the cytokine storm, Dr. Gertie? Have
That's
you
a
seen much of that?
That's a different thing. That, especially at the beginning, and that's what made a lot of people die in the beginning.
Yeah, that's what they were
But
saying. Yeah.
what people need to understand is that it's such a hyper-inflammatory
Right,
disease
right.
that it can lead to blood clots. So when they're worried about, okay, the vaccine may have a 0.03 or 0.04% chance of blood clot, COVID-19 infection itself has a 16.5% chance of giving us
55 or 5%?
16.5
16.5%.
versus 0.04.
Right. From all the other vaccines.
Yeah. So
of a
the
blood
risk
clot.
of getting blood clot is much higher with COVID infection itself than you will ever get from the vaccine. And also, just being a woman,
Yeah.
with not on oral contraceptive, your risk for getting blood clots is much higher.
Higher than-
And then if you're a woman that's on oral contraceptive,
Right.
your
It
risk
goes up,
is
doesn't it?
even much
Yeah.
higher.
Yeah.
So compared to the normal population, really is negligible.
People should, I'm a very big proponent of vaccines. Of course you are, and of course everyone that's been on my show is a proponent of the vaccine. But what would you say to people that are mRNA is, this is a real breakthrough that will probably be used with cancer, diabetes, and every other kind of disease that is chronic out there. What would you tell people about, and they don't have to take the mRNA. AstraZeneca, when it gets EUA, is also a viral vector. So,
Correct. It's a
and
viral
Novavax
vector.
is a recombinant or something.
Recombinant, yeah.
Yeah. So only 2 are mRNAs right now.
Yeah, Pfizer and Moderna.
Right. So there's a plethora to choose from, which is good, and they're different technologies. Again, I'm a J&J girl. One shot and done.
I am amazed at the science behind this. And people say, oh, everything was done fast. It's not
It
true.
has to go through our same FDA and CDC process,
apart
doesn't it?
from all the processes it had to go through,
Right.
people don't understand the history of this technology. The
mRNAs, you mean. Right.
It's been they've been working on this for more than 30 years.
Right.
By the 1990s, they were doing studies on using
I
mRNA.
wonder why they never used it for something major before.
Well, the thing
like
is,
cancer.
at that time when they were doing that study,
Yeah.
and they figured out it was on rats. I think it was University of Wisconsin when they first started in the 90s. And then
And it's messenger RNA for
messenger
people who don't know what
RNA,
that-
yeah. And then they found that there was a problem with, being able to, it would just react. And then they figured out how to solve that problem 15 years later in 2005.
Okay.
And so this is not new at all. They've been working on this technology. They finally perfected this technology. And it's almost like preparation met opportunity.
That's right.
And the opportunity was with COVID.
Right.
And so I tell people there was a lot of reasons why this vaccine came out so fast.
Well, even the viral vector came out fast. J&J came out fast.
Yeah, but
So-
the
because
truth
it was
is
already there, the technology.
And
Yeah.
apart from that, the coronavirus, COVID-19 is a unique one. It's a different one.
Than
But
the cold
yeah,
and
but
the
we
SARS
do have,
one.
We do have coronaviruses
That's right, all
in
the
nature
time.
that have been causing common cold.
Yeah.
And they've been studied a lot for so many years. So it's a similar...
Maybe they can use it to cure the common cold. I wish they could, the mRNA.
I mean, I
Yeah.
haven't seen too many patients with common cold
I had a
this
cold
past
last
1
year.
year.
Yeah, I
A lot
did.
of people, and I think it's because people were masking up.
Yeah.
A lot of times people weren't in.
And you
know,
haven't seen as
gathering.
much flu is because of probably
Exactly.
the masking up also.
Exactly.
Yeah.
So I was talking about the coronaviruses.
Yes.
The coronaviruses there's a lot of knowledge. We already know how these viruses behave.
Right.
And so that the COVID-19 is a newer one, is just in terms of the symptomatology.
Well, it's just SARS-CoV-2, where we had SARS-CoV before,
and
that
before
went away
that,
after 2 years.
And before that, we had MERS, and we had also other coronaviruses.
Right, it's so many.
So we have a lot of technology that you just piggybacked on.
Anything else, Dr. Gertie, you want to?
I want our people, especially a lot of black people don't tend to trust the healthcare system.
Right.
And I get it. I know why.
Right.
And I'm telling them that they need to go out there and get themselves protected with the vaccine, themselves and their families.
But you know what, when I was on the home health geriatrics, a lot of older people that, a lot of concerns are older people with COVID and other diseases. But I didn't find out I didn't find many that were ever thinking that their health care was any worse than a white person's or a Latino. It's the same doctors, it's the same Medicare, the same Medicaid that they use. And we have so many great black doctors in this city. That's one thing. And great white doctors too. We have great doctors of any color. Don't you think a lot of the vaccine scare comes from the Tuskegee
That's what
study?
I'm saying.
Yeah,
But
but even,
exactly.
I think now people get really good health care.
Yeah,
in the systems, older people. Yeah, you would be what do you think?
What I think, I agree that Tuskegee is contributory. The Henrietta Lacks case,
Right.
where they used her cancer cells,
Yes, still
didn't
are
inform
using
her,
it, yes.
didn't compensate her.
That's right. And her family went back and sued them. Did they ever get any money? I think they did, didn't they?
I think
and they
were able
deserve
to.
it. What a special woman.
And that's not the only times, right?
Right.
You would have situations where black people don't feel like the healthcare system have treated them well. So it doesn't matter what you say, it's people's experiences.
Yeah, but I've had thousands of people too at home health, okay, and they were all geriatric. And I've never heard one complain about how they've been treated or about their doctors or about not getting good service. But do you get that now in your practice a lot?
I hear.
And is it about the hospitals? Is it about Medicare? Is it about the doctor?
It's not about Medicare. It's not about the insurance companies.
It's about the doctor.
It's just about how they feel.
How do they feel? That's what I'm trying to.
People don't feel like the system treats them well.
But they have to have some whys on why they feel
it's
like
just how somebody treats you, how you feel that somebody treats you.
Okay.
Is that factors
so they're
into
feeling,
it. Like if you don't feel like somebody treats you well, you may not want to go there.
That's what I'm trying to see. What part are they saying? Is it the doctor? Is it the hospital when you're in the hospital?
The system.
Tell me who the system is.
I'm not going to get into all that conversation.
I just wanted to know,
But there's been a lot of people.
Because Medicare is part of the system and Medicaid are part of the system.
So it's not, so when you go into a hospital, you're not going to see Medicare there. You're not going to see Medicaid.
Right.
Right?
You're going to see the people that work there.
Exactly.
Well, Dr. Gertie, as always, it's always interesting, but it's good to know that, I guess it's bad to know, that blacks in other countries too are afraid of the government-sponsored vaccines. That's not a good thing.
They don't trust the American government, and they don't trust the Nigerian government.
But these are private companies that, Pfizer and
You
Moderna.
and I know that.
It's not owned by the government.
No, you and I know that.
Yeah.
You don't know what messages people are getting on their Facebook, WhatsApp.
Yeah.
Oh, you should see some of the messages I see. In my opinion, in this COVID, we use social media to disseminate information.
Sure,
so there's
good
good
part of it,
and bad information too.
Yeah.
And it's done a lot in terms of vaccine hesitancy. I think a lot of it will come from social media.
Come on back to Dianne Andrews in Black and White next week.